Hi, today I want to tell you a little bit about shoulder dislocation. The shoulder dislocation usually happens where the shoulder will move in front of the joint. It can be a very painful condition. Very often it's happening in overhead position of the shoulder like this, where a ball or somebody or even a high velocity car accident where the arm is pushed backwards and the shoulder moves anteriorly. Number one symptom is immediate pain and the arm kind of falls. It's going to be, you'll see a bump out of the front of the shoulder sometimes. Some people are actually able to grab that shoulder and shove it back. If you're on a football field during a game, the trainer may do it, but in reality, most of the time you're going to go to the doctor. Shoulder's very painful, may end up at the emergency room. They will move the shoulder back into its position, test you for whether those anterior structures have ruptured during the motion of the shoulder in front. If they have, it may become a surgical condition at that point. So after you've gone to see the doctor, if the x-ray and maybe even an MRI shows that there has been tearing in the front of the shoulder, you're very likely going to be scheduled for surgery. In surgery, the idea is to repair the front of the capsule, to repair possibly the bicep tendon that crosses over the joint, and in any structures that were injured during the dislocation. After surgery, we will usually see you in therapy. And in therapy, what we're working on is making sure for the first 6 to 8 weeks that the shoulder is positioned in a way that it can be held safely so that those anterior structures can scar and can heal. Over time, we start to slowly add motion. We'll start to add motion going forward and down. We'll add motion going out and in. And then over time, we'll slowly start to add motion that will put you in that most dangerous condition and situation. Very often, you long-term are going to avoid any positions like this, at least for the first year, to make sure that those structures are not put on stretch again. We'd love to see you in the clinic. We do a great job with these shoulders. Very often you will benefit from some strengthening of the other structures around the shoulder that can help to protect, even the pectoral muscles in the front that will help to protect that shoulder. When it's put in this position, it will hold it still instead of allowing it to go backwards and for that shoulder to move forward.